South Sudan is increasingly suffering from the impacts of climate change, which are one of the major drivers of the humanitarian crisis currently affecting 80% of the population. And we've seen it worsening. In the last 3 years, floods have shifted from rainfall to actually the expansion of rivers and bursting the banks, which has inundated communities, villages and facilities. It's the most vulnerable that are the most affected, children. Already in the country, 4.5 million children are in need of some form of humanitarian assistance. And now we see without access to healthcare, without access to schools, they're even more vulnerable. In Unity alone, 109 schools are completely flooded out. Some children we've seen actually crossing dangerous waters with their bags on their heads, crocodile-infested waters, just to try and reach a means of education. We are responding. We do have teams across the country. We have boats, we have supplies pre-positioned. UNICEF and partners are providing drugs and vaccines to some of the hardest reached places and to reach the most vulnerable populations. Education in emergencies is something we've established, putting up tents and temporary learning shelters, as well as treatment of disease and prevention of acute malnutrition. But it's not enough. More needs to be done to prevent climate change. We're having to continuously adapt our response, looking at the area and the scale of the scope of what we're seeing, and it's not reducing. We need innovative solutions, and we're looking at preparedness, we're looking at building resilience of communities. But unless there is a wider commitment to prevent the impact of climate change and solve the issue of climate change, South Sudan is going to continue to suffer at a huge scale.
Hi, my name is Joel. I work as a program assistant with UNICEF in Malakal, South Sudan. As part of my work, we normally go for field missions, and to do that we use cars. But as you can see, I'm sitting in this boat. This is the only thing we use currently for to visit our programs. And good enough, we have our drivers who are normally car drivers, but now they've been trained to also be boat drivers. This is to respond to our programs and to the flooding all over. It never used to be like this. When I grew up, and growing up in this region, it never used to be like this. I remember this year I went for a field mission in Ulan County of Upper Nile State, and we had to walk for 9 hours to a health facility. It was somewhere nearby, which was cut off from the county. We went there to deliver some vaccines, and it's really heartbreaking, seeing children, elderly people walking in water for 9 hours, sometimes 10 hours. Sometimes they even sleep in between. So it's really heartbreaking. They have to go walk, to get their basic essentials like food, like medicines. Children are not in schools. They simply can't go to school because of the flooding. They have to walk in water with snakes, with crocodiles. It's heartbreaking. It's heartbreaking. And it's simply all because of all these floods and climate change. We try our best to deliver basic, things like vaccines, wash facilities, but it's never enough. It's never enough. This job can be tough, but I'm really proud that even with the little that we have, we're able to give to those people in need, especially the children.